Hello, my name is Neil Ward, and I'm doing my IV insertion and discontinuing video. I've knocked on the door. I provide privacy. I introduce myself to the patient. I explain the procedure, why we're doing it. We're going to set up an IV line for medication the doctor has ordered. I explain to the patient how long it should take and what's involved. I procure two identifiers. I look at the patient's wristband and it matches my orders. I have the correct patient, I have the correct time, I have the correct procedure, and I have the correct supplies in front of me. Once that's done, I provide hand hygiene. I don clean gloves. After explaining the procedure, I ask the patient if they have any known allergies to anything. The patient says no, they don't. So we're ready to go. I have my supplies here. I prep them. I have gauze, I have alcohol pad, I have my tourniquet, I have tape. I'm going to take some tape, I'm going to pre-cut it. I have my Tegaderm. I have my 22 gauge needle because I'm out of 18 gauges. So, and I have my normal saline, and I have my extension. So, I adjust the patient. I raise the bed to a good height, good working height. After the patient is comfortable, if they're okay and we're ready to go, the patient says yes, they're fine, they're ready to proceed. I find a distal pulse about 6 to 8 inches away from where I want to apply my tourniquet. I found my pulse, it's here, it's good and strong. I take my tourniquet and I'm going to wrap it about 6 to 8 inches above the spot I identified. I'm going to take my alcohol wipe and I'm going to wipe from in to out. I'm going to let that dry about 30 seconds. While that dries, I'm going to prepare the rest of my supplies. I'm going to take my hub, or my catheter rather. I have the needle or the bevel up. I'm going to put some pressure on and I'm going to insert, there it is, about 30 to 45 degrees into the patient. I see it's there. Release my tourniquet. Going to inject my hub. Discard that. I'm going to attach this. Actually, no, I'm not going to do that first. I'm going to take my Tegaderm and I'm going to place it over the hub so I can see the site. And then I'm going to attach my extension, make sure the clamp is off. It is. Apply pressure and support for my site. Take my normal saline, I'm going to plug it in to this port, to this extender. I'm going to aspirate. I don't see any blood in return. I did see a flash in my catheter, so I know I'm there. I have no air in my system, So I'm going to slowly but surely inject my saline to clear the line, make sure I have patency. Okay, my normal saline's in. I'm going to clamp my line to remove this. I'm going to pull up my Tegaderm. I'm going to place my label side here. I'm going to take my line, removing my tourniquet, take my line and tape the line in a manner, making sure my hub is sound. And then I plug the line in, and now we have an IV. I unclamp. I ask the patient, how are they doing? They say they're fine. The procedure went well. I thank them for their time. I take my belongings, I put them away. I write down my initials, the time, the date, and the hub used, and the gauge. Remove my gloves, discard them, and perform hand hygiene. Thank the patient. I put them in a comfortable position, lower the bed, give them their call light, and ask them to let me know, or use a call light if anything happens, or if they need my help. I go and then I document the procedure, the patient, the time, the date, the gauge used, the site condition, anything that may be pertinent to what we just did. Okay. Some hours later, I come back in. I'm a new nurse. I knock on the window. I provide privacy. I close my curtain. I explain who I am. I'm here to remove the patient's IV line. It's no longer necessary. Ask the patient, is that okay? Explain the procedure, say how long it'll take. They say it'll, they agree to it, and I start. I get my gauze, and I have tape. I'm going to pull one more strip of tape just in case I need it, have it ready to go. I do an identifier, 2ID, patient's name, and check their wristband. I do confirm that I have the right patient, the right time, the right procedure. We're ready to go. I perform hand hygiene. I put on clean gloves. I put pressure on to the patient, and I pull with parallel to the skin, the Tegaderm off. I discard the Tegaderm. Maintaining pressure on the site. I look at the site. Is there anything wrong with the site? Does the site look good and patent? It does. I pull my first set of gauze, and I put it and apply pressure as I pull out the catheter. I keep remaining pressure on for about 30 seconds. I'm examining the catheter to see that it's all there. There's no pieces that are broken off. Everything looks like it's supposed to look. I discarded my sharps. I take this piece of gauze off. I dispose of it. Then I take another piece of gauze and my pre-cut tape, and I tape up the gauze over the old site. Ask the patient how they're doing, how they're feeling. They say they feel fine. I see no irritation or infection in the site. The site looks good and healthy. I ask the patient if there's anything else I can do for them. They say no. I lower the bed. I give them their call light. I let them know if they need anything from me. They hit their call light and I'll come help them. And then I remove my gloves, perform hand hygiene, take away all my supplies, thank the patient, and then I go document the time, the procedure, the location of the procedure, where in the arm, which arm, and the site and integrity of the site we remove the IV from. And that is it.